I'm Dr. Shiels with Elite Sport and Spine. For our mobility minute today, I want to go over a topic called neural tension. So a lot of times people will say their hamstrings are really tight when they come in for treatment. And as we go through the exam, we find out it's not their hamstrings that are tight, but they have neural tension or tightness in the sciatic nerve. So one way that you can tell if this is the case for you at home is to bend over and try and touch your toes. So if you bend down and try and touch your toes, and as you can see, I get nowhere near touching my toes here. If the hamstring's tight, you're gonna feel that in the back of the hamstring. If you have neural tension, you're gonna feel that more in the back of the knee, the calf, and into the bottom of the foot. So one way that you can improve that is to go through a nerve mobilization or a nerve glide. So you're gonna get into a similar position as to what you do if you were trying to stretch the hamstring. Now again, in this position, I don't feel any stretch in the back of my thigh at all. So I'm going to keep my torso upright. I'm going to lean forward from the hip a little bit versus rounding through the low back to try to reach my toe. Once I feel that pull in the back of my knee, the back of my calf, I'm going to back off of that just a little bit, and then I'm going to dorsiflex and plantar flex my foot. So I'm going to hold this stretch and go through that movement nice and slowly. There's no rush to this for about 30 to 60 seconds on each side. And again, as I'm doing this, I feel that pull in the back of the knee and into my calf. And very little stretching through that hamstring at all. So you do that on each side for about 30 to 60 seconds, and even after 10 to 15 seconds of doing it, you'll probably notice a difference. But the effect that this has is when you bring your toes up, it tensions the bottom part of the nerve, and when you point your toes away from you, it takes tension off of that bottom part. So it has the effect of gliding or flossing the nerve through the muscle tissue and the fascia that the nerve travels through as it runs down the back of your leg. So do that for a little bit, and then when you go back, you can retest that, go try and touch your toes again. You're gonna notice that you're able to get down much further. So if you work on that for a minute or two every day over the course of a couple weeks, you're gonna start to notice much less of that nerve tension and much more flexibility. Hopefully that helps out.